Hello, I am Janet Stewart. I am 75 years of age, 75 young, and I was diagnosed with multiple myeloma.
In 2010, I found out that I had lymphoma and went through about 7-8 months of treatment myself. Went through, I think, 7 rounds of chemo, had a stem cell transplant, was pretty much confined to my house for about a year, didn't work for nearly 2 years.
My name is Claudia Warren Wheat. I'm a licensed clinical social worker with Georgia Cancer Specialists.
We do have cancer that runs through our family. My grandma and her mom actually passed away from cancer, and my grandmother's sister passed away from breast cancer as well.
I'm not unusual in the fact that cancer certainly touched my family, both in a very direct way with my immediate family, as well as my father and his father and my mom's father.
When my dad was diagnosed, we only had a few weeks before he passed. But to hear him say in those few weeks, I don't know if it's worth fighting because it will cost you guys so much, just killed me.
It was quite a devastating diagnosis. You know, I knew nothing about it. But the word cancer was frightening.
You know, as a social worker, I feel like I work on the front lines and I see pain every single day. And
multiple myeloma in particular, it seems to hit the elderly the most. And as you know, we are usually quite strapped financially because we have limited resources. We are on a budget, on a tight rope, and treatment is so expensive. And this is where the foundation comes in.
ACCF really puts the focus on taking away at least one of those difficult situations with respect to that diagnosis. How can we take the financial piece off the table?
I know about Atlanta Cancer Care Foundation because I depend on them every single day to make the lives of our patients just so much easier.
What's different about the Atlanta Cancer Care Foundation is that A, it's local. The patients that we help are in our backyard. It's Metro Atlanta, and that's what we do. But the second thing, the most important thing, is that we're actually helping them pay their bills.
What makes the Atlanta Cancer Care Foundation different than other financial assistance programs is the fact that we are locally focused. We serve patients right here in Metro Atlanta, and because we focus locally, we're able to react more quickly, providing assistance typically within 24 to 48 hours of when we receive the completed application, and we're able to communicate directly with each patient in a compassionate way to let them know that we're here to help and that they're not alone in facing the disease.
And I just simply do a 2-page application to the foundation. And I generally get a response within 24 hours as to whether or not they can help our patients through that immediate crisis. And basically, that's how they help us.
Once we have the documentation, we're able to make a payment within 24 to 48 hours typically.
They look out for us. They look out for the community in particular.
Last year, we were able to assist 986 patients with more than $308,000 worth of grants. That was up from more than $256,000 worth of grants the previous year. I wish I could say that that met the entire need and that we were able to serve everybody, but unfortunately that need keeps growing.
So the impact of the foundation on my life is being able for me to have treatment and not worry about where is the next dollar going to come from.
So let's talk about how widespread this issue could be. There's really 2 factors to consider. One is how often are folks faced with a cancer diagnosis.
Sometimes the biggest stress for cancer patients isn't just the medical diagnosis, it's the financial concerns. There have been recent studies that shown that the financial stress or financial toxicity can be just as dangerous as the medical condition.
We're finding that just here in Georgia, that 56,000 people are estimated to get a cancer diagnosis in the year 2018. Couple on top of that, CNBC recently reported that 47% of Americans could not afford a financial emergency of $400 or more.
And I don't think people realize the impact that cancer has on a family, not only on their body, but on their entire life, and especially on their pocketbook.
In a recent study, the cancer support community showed that 30% of the patients that responded to their survey had completely depleted all of their savings because of their diagnosis. 11% had canceled medical appointments with their oncologists or other providers because they didn't know how they were going to pay for it. And another 11% had decided not to pick up their prescriptions that the doctors said they needed to finish their course of treatment because they had no way to pay for it. Those are the kinds of situations that we're trying to prevent.
It's amazing the work that's been done to this point. You know, the foundation started in 2001 with a few patients, and it's grown exponentially to what it is today. But I don't think in any way, shape, or form we can be satisfied with the work that needs to still be done.
And I think as a board, what we'd love to do is, let's not do 1,000, let's do 2,000, let's do 3,000. I mean, what was the statistic of people that are getting a cancer diagnosis in Georgia? 50-something thousand people a year? It's insane. There's a huge need. It's right here in our backyard. And nobody's filling it. We're the only ones doing this.
I would hate to think that there's somebody who is devastated by a diagnosis, who has need, and that need can't be filled.
The goal of the Atlanta Cancer Care Foundation is to make sure that they don't have to worry about the other financial burdens. They can focus on following through with that course of treatment.
And it goes into the bank account of people who need it, and it's changing lives, and it's helping people pay rent, it's helping people pay utility bills, it's helping people put gas in their car, pay a car insurance for that month. So whatever you can do, I think it'll be highly appreciated.
I would urge anyone hearing this to donate because it is important.
Atlanta Cancer Care Foundation, how I see them is, I feel like the money comes in their door, and then as the money comes in their door, they give it to the patient, and it makes a lasting impact.
So I think we have to attack this problem here in the city of Atlanta, and we have to be very aggressive about it.
If anyone's considering donating to any foundation, I would highly recommend Atlanta Cancer Care Foundation, because I see the money at work. I see it changing lives.
So today, tomorrow, and the next day, I encourage you all to reach out to the Atlanta Cancer Care Foundation. Donate as much as you possibly can, for each patient is very appreciative. It goes right into their hands. It helps out with much needed care, financial stability, overall sustainability.
And as a social worker, I'm invested in, being part of that process. So whatever can be done to help me in my work, to help change lives, please, monetary, donate to the Atlanta Cancer Care Foundation. I'm not sure how else to say it.
You can support the Atlanta Cancer Care Foundation and our Patient Financial Assistance Program by going to our website at www.atlantacancercarefoundation.org and click on the Donate button. You can make a one-time or recurring donation in whatever amount you choose, and know that every dollar you give is helping to support cancer patients in need.
Today, I am feeling super. I am back in treatment, and I am responding very well to it, and I am looking forward to living.